Question 1. A technician is using a washer disinfector to process surgical instruments. The final rinse cycle utilizes highly heated water to eliminate the majority of microorganisms, though it does not completely eradicate bacterial spores. What is the correct classification for this specific phase of the processing cycle? A. High-level disinfection, HLD. B. Thermal disinfection. C. Sterilization. D. Bactericidal processing. Correct answer B. Knowledge point explanation. Core rationale: thermal disinfection is a process that utilizes heat, rather than chemicals, to eliminate most pathogenic microorganisms on an inanimate object, with the exception of bacterial spores. Washer disinfectors typically achieve this during the final rinse by reaching specific high temperatures. Trap analysis: option A is incorrect because HLD is typically achieved via chemicals for semi-critical items, whereas this scenario specifically describes a heat-based process. Option C is incorrect because sterilization completely destroys all microbial life, including highly resistant bacterial spores. Option D is incorrect because bactericidal refers to a characteristic of killing bacteria, not the specific name of this thermal process. Concept extension: the effectiveness of thermal disinfection is dependent on two primary variables: water temperature and exposure time. Question 2. During the preparation of a patient care area, a staff member applies a specific chemical agent to an inanimate stainless steel transport table. The product label indicates it effectively eradicates the majority of pathogenic organisms but is not formulated to destroy bacterial spores. Which of the following best describes this chemical agent? A. Antiseptic. B. Disinfectant. C. Liquid chemical sterilant, LCS. D. Bacteriostatic solution. Correct answer B. Knowledge point explanation. Core rationale: a disinfectant is strictly defined as a chemical agent used on inanimate surfaces to destroy nearly all recognized pathogenic microorganisms, but it does not have the capacity to kill large numbers of bacterial spores. Trap analysis: option A is incorrect because antiseptics are specifically formulated to be used topically on animate, living, tissue, not inanimate objects. Option C is incorrect because a sterilant would be capable of destroying all microbial life, including spores. Option D is incorrect because bacteriostatic means inhibiting growth without necessarily killing the organisms, whereas a disinfectant actively destroys them. Concept extension: disinfectants are categorized into low, intermediate, and high levels based on their kill capability and the Spalding classification of the item being processed. Question 3. Prior to a surgical incision, the operating room nurse applies a specialized solution directly to the patient's skin. This solution is designed to inhibit the growth and reproduction of resident bacterial flora on living tissue. What is the correct terminology for this type of solution? A. Antiseptic. B. Environmental disinfectant. C. High-level disinfectant, HLD. D. Descaling agent. Correct answer A. Knowledge point explanation. Core rationale: antiseptics are specialized antimicrobial substances that are applied to living tissue or skin to reduce the possibility of infection, sepsis, or putrefaction by inhibiting bacterial growth. They must be mild enough not to damage living cells. Trap analysis: option B is incorrect because environmental disinfectants are heavily toxic and designed strictly for inanimate surfaces like floors or tables. Option C is incorrect because HLDs, such as glutaraldehyde, are highly toxic chemicals used for semi-critical instruments and would cause severe tissue damage if applied to skin. Option D is incorrect because descaling agents are used to remove mineral deposits from equipment, not for preparing patient skin. Concept extension: common examples of antiseptics used in healthcare include specialized iodine formulations and 70% isopropyl alcohol for surgical skin prep. Question 4. A sterile processing department, SPD, technician is manually processing a semi-critical medical device using a chemical basin. The manufacturer's instructions for use, AFU, specify that the device must be completely submerged and remain continuously exposed to the fluid for exactly 12 minutes to achieve the desired microbial kill rate. What does this 12-minute requirement represent? A. Disinfectant holding time. B. Minimum effective concentration, MEC, duration. C. Wet contact time. D. Chemical activation period. Correct answer C. Knowledge point explanation. Core rationale. Wet contact time refers to the absolute, uninterrupted length of time an item must remain visibly wet with a disinfectant solution to ensure sufficient exposure to eradicate targeted pathogens. If the device dries before this time elapses, the disinfection process fails. Trap analysis. Option A is an unofficial distractor term and does not represent the standardized SPD terminology for this concept. Option B is incorrect because MEC refers to the required strength or potency of the chemical tested via strips, not the duration of soaking. Option D is incorrect because the activation period refers to the time needed to mix two-part chemicals, like glutaraldehyde, before use, not the soaking time for the instruments. Concept extension. Maintaining appropriate wet contact time is particularly challenging when using rapid evaporating disinfectants like alcohol on large environmental surfaces. Question 5. After an endoscopic procedure, a flexible gastroscope undergoes a chemical process that successfully destroys nearly all recognized pathogenic microorganisms on its surface, although it may not eliminate a high number of bacterial spores. Which of the following terms accurately defines this specific level of microbial destruction? A. Disinfection. B. Sterilization. C. Decontamination. D. Bacteriostatic inhibition. Correct answer A. Knowledge point explanation. Core rationale. Disinfection is defined specifically as the destruction of nearly all pathogenic microorganisms on an inanimate surface or device. The critical distinction between disinfection and sterilization is that disinfection processes lack the capability to consistently kill large populations of highly resistant bacterial spores. Trap analysis. Option B is incorrect because sterilization mandates the complete elimination of all microbial life, including all bacterial spores. Option C is incorrect because decontamination is the broader initial step of making an item safe to handle, which primarily involves cleaning rather than the targeted chemical destruction of pathogens. Option D is incorrect because bacteriostatic refers to halting bacterial reproduction rather than actively destroying the microorganisms. Concept extension. For semi-critical devices like flexible gastroscopes, the specific subcategory required is high-level disinfection, HLD, which targets all vegetative bacteria, viruses, and mycobacteria. Question 6. Which of the following terms describes a chemical or physical process that possesses the specific capability to actively destroy and kill bacterial cells, rather than merely inhibiting their growth? A. Bactericidal. B. Bacteriostatic. C. Pathogenic. D. Bioburden inhibiting. Correct answer A. Knowledge point explanation. Core rationale. The suffix cidal indicates the definitive capacity to kill. Therefore, a bactericidal agent actively destroys bacteria. This is a critical distinction in the sterile processing department, SPD, when selecting chemicals to eradicate microbial life rather than just pausing its multiplication. Trap analysis. Option B is incorrect because bacteriostatic, static meaning to halt or maintain, only slows or stops bacterial growth without killing them, which is acceptable for some skin preparations but not for instrument processing. Option C is incorrect because pathogenic refers to the disease-causing nature of organisms, not the process of destroying them. Option D is incorrect because bioburden inhibiting is a fabricated phrase. Bioburden refers to the actual population of viable microorganisms on an item prior to processing. Concept extension. high-level disinfectants, HLD, must be highly bactericidal, specifically capable of destroying all vegetative bacteria, viruses, and mycobacteria, such as the organism causing tuberculosis. Question 7. A technician is preparing a manual soak basin with a high-level disinfectant, HLD, solution formulated with orthothalaldehyde, OPA. According to standard operating procedures, how frequently must the technician utilize chemical test strips to verify the minimum effective concentration, MEC, of this solution? A. At the beginning of each 8-hour shift. B. Prior to each individual use. C. Once daily during the morning setup. D. Only after adding freshly mixed solution to the basin. Correct answer B. Knowledge point explanation. Core rationale. HLD solutions degrade over time and become diluted by the residual moisture introduced by wet instruments. To guarantee that the chemical remains potent enough to achieve pathogen destruction, the MEC must be explicitly verified with a specific test strip prior to each use. Trap analysis. Option A is incorrect because testing only once per shift is insufficient. The solution could fall below the required concentration after the first few uses. Option C is incorrect because daily testing presents the same risk of using diluted, ineffective chemicals later in the day. Option D is incorrect because adding fresh solution to an old basin is a dangerous practice known as topping off, which is prohibited. Testing must occur every single time an instrument is processed. Concept extension. If the MEC test strip fails to indicate the required passing color, the entire volume of solution must be immediately discarded, regardless of whether the 14-day or 28-day expiration date has been reached. Question 8. What is the precise classification for a comprehensive processing method that guarantees the complete eradication and destruction of all forms of microbial life, including highly resistant bacterial spores, on a critical medical device? A. High-level disinfection, HLD. B. Thermal pasteurization. C. Sterilization. D. Intermediate-level decontamination. Correct answer C. Knowledge point explanation. Core rationale. According to the Spalding classification system, critical items, those entering sterile tissue or the vascular system, carry an extreme risk of infection and must undergo sterilization. Sterilization is the absolute elimination of all microbial life, distinguished from all forms of disinfection by its ability to reliably kill massive quantities of bacterial spores. Trap analysis. Option A is incorrect because HLD is reserved for semi-critical items and kills most pathogens but lacks the capability to consistently destroy high numbers of spores. Option B is incorrect because thermal pasteurization is an older method utilizing hot water, typically 160 degrees Fahrenheit to 170 degrees Fahrenheit, for 30 minutes, which achieves disinfection but not sterilization. Option D is incorrect because intermediate-level processes only target vegetative bacteria and some fungi, leaving spores entirely intact. Concept extension. Common methods to achieve this absolute state include pressurized steam, autoclaving, ethylene oxide, ETO, gas, and low-temperature hydrogen peroxide vapor. Question 9. During the manual processing of a flexible endoscope, a technician prepares to immerse the device into a basin containing a non-glutaraldehyde high-level disinfectant, HLD, known for a rapid manual contact time of 12 minutes at 68 degrees Fahrenheit. Which chemical is the technician utilizing that strictly requires a minimum effective concentration, MEC, test before every use? A. Orthothalaldehyde, OPA. B. Quaternary ammonium compounds, QUATs. C. 70% isopropyl alcohol. D. Concentrated phenolic solution. Correct answer A. Knowledge point explanation. Core rationale. OPA is a widely used HLD for semi-critical instruments. It is chosen for its fast manual wet contact time, typically 12 minutes at room temperature, 68 degrees Fahrenheit, and because it does not require activation. Like all reusable HLDs, Its potency must be verified with an OPA-specific MEC test strip prior to every single use. Trap analysis. Option B is incorrect because quats are low-level disinfectants used on environmental surfaces, not for submerging semi-critical endoscopes. Option C is incorrect because alcohol is an intermediate-level disinfectant that evaporates too quickly to maintain a 12-minute soak time and cannot achieve HLD status. Option D is incorrect because phenolics are intermediate-level disinfectants that leave toxic residues and are explicitly contraindicated for devices contacting mucous membranes. Concept extension. A unique diagnostic feature of OPA is that it stains residual proteins a distinct blue or gray color, serving as a visual indicator if an instrument was improperly cleaned prior to disinfection. Question 10. An educator is observing a new employee manually disinfecting a multi-channel colonoscope in an immersion basin. The educator intervenes when the employee fails to forcefully inject the chemical solution through the device's narrow channels using a large syringe. What specific complication is the educator attempting to prevent by ensuring the channels are completely filled with fluid? A. The formation of air bubbles that block chemical contact. B. The rapid evaporation of the high-level disinfectant. C. The immediate depletion of the solution's minimum effective concentration, MEC. D. The premature expiration of the activated chemical. Correct answer A. Knowledge point explanation. Core rationale. When processing hollow lumens or channels, air pockets can easily become trapped inside. If air bubbles are present, the disinfectant liquid cannot physically touch the inner walls of the lumen, completely defeating the wet contact time requirement and resulting in a contaminated device. Trap analysis. Option B is incorrect because evaporation is primarily a concern for fast-drying surface disinfectants like alcohol, not for fully submerged HLD basins. Option C is incorrect because while improper dilution, from a wet scope, affects MEC, failing to flush channels with a syringe creates a physical barrier, air, not a chemical depletion. Option D is incorrect because the expiration date is dictated by calendar days, e.g., 14 days after pouring, not by the physical act of flushing channels. Concept extension. This same principle applies to automated systems. Automated endoscope reprocessors, AERs, have specific hookups to forcefully pump fluid through all channels to displace air and guarantee total chemical contact. Question 11. A sterile processing department, SPD, technician is tasked with wiping down environmental surfaces, such as stainless steel prep tables and floors, using a specific low-level disinfectant. The departmental guidelines strictly prohibit the use of cotton rags with this chemical because cotton absorbs the active ingredients, rendering the solution ineffective. Additionally, this chemical is incompatible with standard soaps. Which chemical family is the technician utilizing? A. Quaternary ammonium compounds, quats. B. Halogens. C. Phenolics. D. Glutaraldehyde. Correct answer A. Knowledge point explanation. Core rationale. Quaternary ammonium compounds, quats, are widely used low-level disinfectants for environmental sanitation. However, they are prone to cotton depletion, where natural fibers like cotton or wool absorb the active chemical, lowering its concentration on the surface. They are also easily neutralized by anionic substances like common soaps. Trap analysis. Option B is incorrect because halogens, like chlorine, are intermediate-level disinfectants that are highly corrosive to stainless steel tables. Option C is incorrect because phenolics, while used for environmental surfaces, are not primarily known for cotton depletion and leave a hazardous film. Option D is incorrect because glutaraldehyde is a toxic high-level disinfectant strictly used for semi-critical devices, not for wiping down open environmental surfaces. Concept extension. To prevent depletion when using quats, facilities mandate the use of synthetic spunlace wipes or microfiber cloths rather than natural cotton materials. Question 12. A facility processes heat-sensitive semi-critical endoscopes using a manual chemical immersion method. The selected high-level disinfectant, HLD, requires the technician to mix an activator liquid into the base solution prior to its first use. Due to the chemical's noxious fumes, Occupational Safety and Health Administration, OSHA, guidelines mandate that the technician process the items in a heavily ventilated room with a minimum of 10 air exchanges per hour. Which chemical is described in this scenario? A. Glutaraldehyde. B. Orthothialdehyde, OPA. C. 70% isopropyl alcohol. D. Hydrogen peroxide vapor. Correct answer A. Knowledge point explanation. Core rationale. Glutaraldehyde is a potent HLD used for semi-critical devices that typically comes in two parts requiring activation before use. Its primary drawback is the emission of toxic vapors that act as severe respiratory irritants, necessitating strict OSHA safety controls, including specialized ventilation and butyl rubber gloves. Trap analysis. Option B is incorrect because OPA does not require activation, it is ready to use, and has significantly less odor and fewer respiratory hazards compared to glutaraldehyde. Option C is incorrect because alcohol is an intermediate-level disinfectant, not an HLD, and does not require a two-part activation. Option D is incorrect because hydrogen peroxide vapor is used in automated low-temperature sterilization systems, not as a manually mixed liquid immersion process. Concept extension. Once activated, glutaraldehyde solutions typically have a limited use life, e.g., 14 to 28 days, which must be strictly documented on the secondary container along with the activation date. Question 13. Which of the following widely utilized intermediate-level disinfectants is most significantly compromised by its rapid evaporation rate, making it extremely difficult to maintain the mandated 5-minute wet contact time on medical equipment, while also being easily inactivated by organic soil? A. 70% isopropyl alcohol. B. Chlorine. C. Concentrated phenolics. D. Peracetic acid, PAA. Correct answer A. Knowledge point explanation. Core rationale. Alcohol, specifically 70% isopropyl alcohol, is a fast-acting intermediate-level disinfectant. Its fatal flaw in large-scale disinfection is rapid evaporation. It dries so quickly that maintaining the required 5-minute continuous wet contact time is nearly impossible on large open surfaces. It is also instantly deactivated if protein or blood, organic soil, is present. Trap analysis. Option B is incorrect because while chlorine is inactivated by organic soil, its primary limitation is its extreme corrosiveness to metals, not its evaporation rate. Option C is incorrect because phenolics do not evaporate instantly, rather, they leave a toxic residual film that is difficult to rinse off. Option D is incorrect because PAA is an acidic sterilant primarily used inside automated, sealed machines where evaporation is not a factor for wet contact time. Concept extension. Due to this evaporation challenge, alcohol is usually restricted to wiping down small items or serving as a final drying flush in the channels of endoscopes rather than broad environmental disinfection. Question 14. During a shift in the decontamination area, a technician prepares to clean up a large biohazard blood spill on the floor using a specific intermediate-level disinfectant from the halogen family. However, the lead educator warns the technician never to use this same chemical on stainless steel surgical instruments, as it will rapidly cause irreversible pitting and structural damage. Which chemical is the educator referring to? A. Chlorine. B. Orthothialdehyde, OPA. C. Quaternary ammonium compounds, QUATs. D. Glutaraldehyde. Correct answer A. Knowledge point explanation. Core rationale. Chlorine, commonly bleach, belongs to the halogen chemical family. While it is an excellent and inexpensive intermediate-level disinfectant for cleaning up blood spills on non-critical floors, it is intensely corrosive to metal. Exposing stainless steel surgical instruments to chlorine rapidly strips their protective passive layer, leading to catastrophic pitting and rusting. Trap analysis. Option B is incorrect because OPA is a high-level disinfectant specifically designed to have excellent material compatibility with delicate instruments, not a floor cleaner. Option C is incorrect because quats are low-level disinfectants generally safe for metals, though ineffective against large blood spills. Option D is incorrect because glutaraldehyde is an HLD used for instrument processing and is not a member of the halogen family, nor is it routinely used for floor spills. Concept extension. Another common halogen used in healthcare is iodine, which is typically formulated as an iodophore, antiseptic, for patient skin preparation rather than hard surface disinfection.